Hello friends, this is Dr.Karthikeyan doing MD Medicine at MAMC. So today we are back with our Let's Know Why series episode 3. Today we'll be seeing how a simple ECG can make an interesting diagnosis. Let's go. 20-year-old female came to our emergency with recurrent episodes of syncope, meaning 4 episodes of syncope in the last 2 weeks. On further questioning, she told she sleeps peacefully, but after she gets up from sleep, when she starts to brush, at that time she starts feeling palpitations as well as sweating episodes. And then she becomes dizzy and she faints off. Her vitals at admission was BP 120/70, sugar 123, pulse rate 130, respiratory rate 16, SpO2 98% on room air. Systemic examination was done. Everything was found to be normal. And blood investigations, hemoglobin 13 gram, and rest of the investigations were all normal. This is the resting ECG of the patient. Yes. And this is the ECG of the patient when she was having palpitations. Yes. So since she was having recurrent episodes of syncope, MRI head was done, which was found to be normal. And echocardiography was done, which was also found to be normal. Yes. Now it's your job to find out what's the possible condition going on in her. At the same time, is there any special investigation or test to diagnose this condition? At the same time, what dietary modification can be advised to this patient so that she won't develop future episodes of syncope? Then, what's the drug approved for this condition? If you think you want some clue or if you are not sure of approaching an tachyarrhythmia and ECG, check out on my latest video on how to approach a tachyarrhythmia by complete understanding of its pathogenesis. Okay, yeah. Thank you guys. If you like this video, like it, comment, share it, as well as subscribe to our channel for future videos like this. And the solution for this video will be discussed in our WhatsApp as well as Telegram groups. Thank you.